Assalamu alaikum, welcome to VetLec. Today I am going to discuss the anatomy of ulna of dog. Ulna is a long and thin bone and it is the longest bone in the forearm. Its main function is the muscular attachment and it also forms elbow joint. So proximally it articulates with humerus and radius while distally it articulates with radius and carpal bones. It is present caudolateral to the radius bone as it occurs in pair radius and ulna. So it is present caudolateral to the radius bone and it is tapered from the proximal extremity to the distal extremity. So it has two extremities, one is the proximal extremity, other one is the distal extremity, and between these two extremities there is a body of ulna. First I'll discuss the proximal extremity of ulna. Proximally it contains a huge bulging process, which is known as olecranon. This olecranon is further composed of two parts. One is the olecranon tuberosity. This is the olecranon tuber or tuberosity, and this is the enconial process. This olecranon tuberosity or tuber is enlarged and rounded caudally. This is the caudal aspect. This is the caudal aspect of the ulna. So it is enlarged and rounded caudally. Here you can see it. It is enlarged and rounded caudally, and it is concave from the medial aspect, while laterally it is convex laterally. Sorry, it is convex laterally, while it is concave medially. As you can see here, it is concave here. This is the medial aspect of ulna. So it is concave at the medial aspect, while laterally it is convex, and caudally it is round and enlarged. The other part of the olecranon is the enconial process, which is a sharp edged process and it is present cranially. This all is the cranial view, this is the caudal view, and this is the medial view of ulna. So here we have enconial process and it is present cranially. Here it is not much clear, so otherwise it is present cranially. Here it is the enconial process, so it is present cranially and it is a sharp edged process, and this enconial process fits in the olecranon fossa of humerus when elbow joint is extended. So here we have enconial process. This is enconial process. This is enconial process of olecranon, and this olecranon tuber forms the point of elbow. Then just distal to the enconial process, there is a semi-lunar notch, or we call it half moon shaped notch, which is known as trochlear notch. This is the trochlear notch, just distal to the enconial process. And as its name indicates that it is trochlear notch, so it articulates with the trochlea of the humerus. Therefore it is known as trochlear notch. Then just distal to this trochlear notch, there is a process which is known as coronoid process, having further consisting of two parts. One is the medial coronoid process and other is the lateral coronoid process. So this one is the medial coronoid process and this is the lateral coronoid process, where medial coronoid process is larger than the lateral coronoid process. This is the medial coronoid process and this is the lateral coronoid process, and here this is the medial coronoid process and this is the lateral coronoid process. So actually this semilunar notch, which is known as trochlear notch, is present between the enconial process and medial coronoid process. So it is present between enconial process and medial coronoid process. Then just distal to the medial coronoid process, there is a small elongated eminence which is known as ulnar tuberosity. So here we have ulnar tuberosity here. This is the ulnar tuberosity. So here ulnar tuberosity is present just distal to the medial coronoid process. Then between the medial coronoid process and lateral coronoid process, a radial notch is present, and this radial notch actually articulates with the articular circumference of radius bone. So this radial notch of the ulna is present at the cranial aspect of ulna bone, and as its name indicates, it articulates with the articular circumference of the radius bone. So here we have a radial notch between the medial coronoid process and lateral coronoid process. Now let's discuss the body of ulna. Body has interosseous border, and body of ulna has interosseous border, and just middle to and just proximal to the middle third of the body, it is compressed from the lateral side, while distal to the middle third of the body, it gradually loses its border and becomes pointed and irregular. So this is the middle third of body, and proximal to this middle third, it is compressed laterally, as this is the lateral aspect of ulna bone, and it is compressed, you can see here. So just proximal to the middle third of the body, it is compressed at the lateral side, while distal to the middle third of the body, uh, it becomes irregular and pointed, and gradually loses its interosseous border. So here you can see that it is gradually losing its border, and it has become pointed here. So this was about the body of ulna. Now let's talk about the distal extremity of ulna. Distal extremity of ulna contains an articular circumference and a styloid process. So the ulnar bone articulates with the ulnar notch of radius bone with the help of this articular circumference. So here we have articular circumference, and this articular circumference actually articulates with the ulnar notch which is present at the radius bone. And this articular circumference is it ends at a styloid process. This articular circumference ends at styloid process, and then this styloid process further articulates with ulnar and accessory carpal bones. So here we have styloid process, and it articulates with accessory carpal bones and ulnar carpal. Now as you can see in the picture, that this is the radius bone, cranial aspect of radius bone, and this is the ulna bone. So here we have styloid process of ulna, which is present uh, at the lateral aspect of radius bone, and this whole ulna bone is present caudolateral to the radius bone. This is the radius, this is the cranial aspect of radius bone, and this is the lateral aspect of radius bone, lateral border. And you can see here that ulna bone is present caudal to the radius bone and lateral to this radius bone. So we call that ulna is present caudolateral to the radius bone. And this is the styloid process of the ulna bone, and it is also present lateral to the radius bone. And this is the styloid process of radius bone, which is present medial to the radius bone, at the medial border of radius bone at its distal extremity. This is the medial aspect of ulna bone. This is the enconial process, and this is the this is the enconial process, and this is the olecranon. So this is all about ulna. Now let's talk about the muscular attachments of ulna. The olecranon tuberosity, which is the enlarged and rounded portion of olecranon, and it forms the point of, as it forms the point of elbow. So this enlarged and rounded portion of ulna contains insertions for three types of muscles. One is the tricep brachii muscle, enconius muscle, and tensor fascia antebrachia muscle. So these three muscles are inserted at this rounded olecranon tuberosity. Then the other part of olecranon, which is the medial surface of olecranon, which we have called that it is concave. The medial surface of the olecranon is concave, as you can see here. So this concave surface or medial surface of olecranon contains two muscles, which are deep digital flexor muscle and a flexor carpi radialis muscle. And these both muscles originate from this medial surface of the olecranon tuberosity or olecranon tuber. So this was all about the ulna of dog. Thank you.